So yeah, so I'm a personal trainer, so obviously sweat a lot in the gym and things, and I know when it gets closer to summer, you know, when you just want to be able to wear clothes where you're just not gonna be like hot, especially after going to the gym. I think the more you go to the gym, the more you sweat as well. So yeah, it's not like a massive issue, but it'd be nice to not have that issue at all.
Okay.
Yeah.
So we're looking at underarm sweat. Have you had Botox before then?
I have actually, and it worked really well.
Did it? Perfect.
Yeah.
Have you ever heard of MiraDry?
No.
Okay. So MiraDry is a device therapy, and it uses heat energy. And what it does is it destroys the sweat glands at 3 or 4 millimeters, and it stops sweat. It reduces sweat permanently.
Right. Okay.
By around about 80%.
Wow, that's amazing.
So 2 people in this room have had it. I've had it, and so there's Meg here. And so it's an effective treatment. If you're not sure and you want to think about it, then you can always do Botox. Botox has very little complications, very little downtime, and it's effective about 2 or 3 months, maybe 4 months.
The best one to do,
Yeah, I mean it's a discussion. Like we can have that discussion and think about what's the best way to do it. I like MiraDry. The only problem with MiraDry is, you're quite thin because obviously you're athletic, and that can sometimes lead to a bit more of a downtime. But I prefer you look into it, read about it, and then you can make a decision whether you want to do that. If you want to do the quick fix, then that is Botox. It'll last 3 or 4 months, and you can it will kind of go, and then we can always redo it. I find Botox is effective. It's just a little bit expensive. It doesn't last very long on someone sweating a lot on their armpits.
Definitely. So. I mean, I am happy to do the one that's the best option, obviously. Well, that's obviously going to be more permanent.
It doesn't completely stop sweat. It definitely reduces it. The best thing to probably do is do a test. So we do a test to see how much you're sweating.
Okay.
And then we can then make a decision from there.
Maybe run or something. What was I going to say? How many treatments do you need for that one? Is it just the one treatment? Oh wow, that's amazing.
It takes about an hour and a half to do.
Yeah.
The procedure takes about half an hour, but they have to be numbed.
Yeah.
The downtime, I'd say, is probably one day going into work, day afterwards.
Yeah.
But after that, you can work. But you swell. You swell for a week or 2.
Yeah. Okay, that's fine.
So have a think.
Yeah.
They'll give you some information.
Yeah.
And then we can tell what we do.
Yeah. Perfect.
So you're here for a MiraDry treatment today?
I am.
Yeah, you a bit excited, a bit nervous?
I'm excited.
Excited?
A bit nervous.
That's good. So tell me a little bit about yourself. Have you ever tried Botox?
I have, yeah. I've had Botox under the arms, and it has worked.
Okay.
Lasted, I think, about 6 months.
That's not bad.
I need something a bit more permanent than that.
And you've only tried Botox once?
A couple of times.
Yeah. And you felt like it lasted about 6 months every time?
Cool.
Okay, that's good. So with MiraDry, the results are permanent. On an average, I would say about 80% reduction. It can vary from patients to patients, but overall, we have amazing feedback about MiraDry. It's a fantastic treatment. So today we're going to start with a very basic starch iodine test, where we place a little bit iodine on the area, place a little bit starch on the area. It helps us to understand how much sweat there is, exactly how much area we need to cover, and then we carry on doing the rest of the procedure, which follows on with your anaesthetic, which is done by the doctor. So I think we've got Dr Rosh today, who's going to be coming in. That's going to be the most uncomfortable part of the treatment. We use a 5-point meso needle, which helps for the procedure to be a lot quicker, but it is not the best part of the treatment, I must say. Once that's done, the area starts to feel numb, and you shouldn't feel any device part of the treatment. Overall, it can take up to about 2 hours. After the treatment, we do arrange a phone call follow-up with you, which is in 2 weeks' time. Not to say you can't get in touch with us before. If you have any concern, you're more than welcome to give us a call. But icing the area for the first 48 hours is very important. Keeping the area very clean is very important. Making sure that you're not putting any products on the area for the first 48 hours as well. And then in 3 months' time, we'll do another follow-up, which is, again, a starch iodine test, which is the most exciting part because it helps you to see how much result you've had from the treatment. Usually, one procedure is okay for patients. Some patients do require a second treatment, which can be done 3 months after the first one. Any questions?
No.
Amazing.
I'm ready to go.
Fantastic. Right, we'll get you started. this little bit of starch on the area. So basically, you leave it on for about 10 minutes, and what it will do is absorb the sweat. So when it goes dark, that's where you've got active sweat glands. So it helps us to compare the before and after results. It's quite fantastic for that. And then also helps us to indicate exactly which size stencil we need to use to get the best results, really. And it's all to do with patient's BMI as well.
Okay, ready? 3, 2, 1, go. Well done. Try and uncross your legs and just relax. The issue about MiraDry is sometimes you will swell after the procedure, but it's a good thing because the swelling is where the thermal energy is heating that 3 or 4 millimeter mark where the sweat glands are.
Yeah.
So the more you swell, actually, the better. When I had it, I iced every hour. I put set an alarm. I iced every hour, 5 minutes.
Really?
It's actually initially it's a bit but then it's quite relieving.
Yeah, okay.
So it actually does affect the hair as well. The hair gets less. Yeah.
So area should start to feel fairly numb now. It starts to work pretty much straight away. The next step is we're going to place a stencil on the area, which helps us to understand exactly which area we're going to be covering. I'll explain how the pulses work as well. So each pulse can take up to 38 seconds to complete. First half of that is when it's going to heat up the tissue. So if you feel any discomfort, let me know. It could be a sharp sensation, it could be a heat sensation. If you can manage with it, it's fine. But if you feel like it's getting a bit uncomfortable, let me know. I just have to press a button, release the device. We ask Dr Rosh to come back in and he can do a bit more anaesthetic. You don't lose that pulse, we override it and we perform it again. So remember, any heat, any sharp sensation, let me know. Completed both sides. I'm just going to cleanse the area now and just going to go over the aftercare. I know that you've received it in your email as well, but I'll just go over it. So just keeping the area very, very clean. No products, no antiperspirants, no deodorants, nothing with fragrance, no body wash, especially for the first 48 hours or so. After that, you're absolutely fine to carry on. Icing is very important for the first 48 hours as well. So ideally, they recommend 20 minutes on and 20 minutes off, which can be a lot to do. So even if you do 20 minutes to the hour, that's absolutely fine.
Straight away.
Straight away. So I'll get the ice packs for you. And that's it. We're all done today.
Amazing, thank you.
No problem.